now like to introduce Steve Parenti, who is the director of the Medical Industry Leadership Institute and an associate professor at the Carlson School of Management at the University of Minnesota. He has served as a consultant to several of the largest organizations in healthcare delivery, including the United Health Group, Blue Cross Blue Shield, the Center for Medicare and Medicaid Services, federal and state governments, as well as medical technology firms. Steve was a health policy advisor for John McCain's presidential campaign and has served as a legislative fellow in the office of Senator John Rockefeller during the health reform initiatives of both the Bush and Clinton administrations. And one thing I particularly find intriguing about Steve, and I was chatting with him earlier about this, is his very interesting work on medical banking technologies. And perhaps at some point in the question period, we may have an opportunity to engage him a little bit in that discussion. So, Steve?
Thanks. Thank you, Amalia, and thank you all for hanging in there. I'll try to make this as interesting as I can. When Amalia approached me to do this, she said, you don't really have to have slides, but just brief introductory slides, and that generally meant, all right, 10 slides, no more than 10 slides. So what I am going to be showing you here is something a little bit different than what you've seen today. My background largely is in health economics. If the opportunity arises, I'll talk to you about medical banking, which in my view is the way to kind of have health IT work better using the existing insurance infrastructure, and some of my questions earlier in the day. What I'm about to show you is things that I'm doing really, I guess, as my day job, because when I was a McCain advisor, really starting out from October of '07 when the campaign didn't even have a chance, that really wasn't my day job. That was sort of a hobby. Since it didn't pay, it definitely was a hobby. This is actually it's a presentation about a course that's designed to do at least three things. One is provide a new font of human capital for folks that work in the medical technology space, MBAs, engineers, and others that actually are aware of all the issues we've been talking about today, so that they don't land at Medtronic or St. Jude going, huh? And this came basically as a response to when I basically teaching an MBA program, talking to folks at Medtronic or St. Jude, saying, when we hire really great students from Chicago or Northwestern, we have this huge turnover problem. They're best available athletes, they're really smart, they get here, they hear about all the minutia in the medtech space, and they go, oh my God. And then they sort of think about where they want to go next to, say, Tyco or GM or something else to that next level. That's one thing. The second thing is actually producing new knowledge. Universities are good at that, but to Amalia's point, universities are also quite siloed in just the way they're oriented. As I'll go into this, I'll show you how I don't like silos at all, especially when I personally get quite passionate about the health IT issue. I think in that case, we have a whole bunch of silos that kill people, literally, because the information is not being shared. And so I think if, at least in my own backyard, I'd like to see a university try to break down its own silos for the good of something. So let's get into this. So I'm going to give you some goals as I see them and perspectives. This is, I'm post-tenure here, so I guess I can say whatever I want without recrimination as long as the university doesn't sink. That's the only clause in any tenure code. If your university is irreparably damaged, tenure's over. So. Just give some sense of where academia and medtech sort of fall together, what the needs of industry are, what I'm going to show you as a University of Minnesota example to try to fuse these things together, and then some issues going forward we can pick up in the Q&A. So when I think about what academia does these days, University of Minnesota is a pretty large research university. We have 30,000 FTEs and grad students. We have roughly 60,000 undergraduates and graduates. It's all based in Minneapolis, if you've ever been to the area, except there's a few surrounding campuses, but most of it's all together with the med school and arts and science all in one spot. And we do basic research, applied science. For the most part, you might think in tuition, maybe these days not so much if you're going to a private school or your kid's going to a private school, but they are nonprofits. And the goal is really to create new knowledge and be accountable for that type of thing and put the new knowledge out into publications. In terms of private industry, the goal is largely development of new products. It's market-driven, it's profit-based, its core issues to intellectual property. It needs to be safe, and it needs to be accountable. And if there's things where these two groups sort of come together, both want financial stability. No one wants to go out of business per se. Minnesota, for example, is going to be having a self-imposed furlough that actually the university senate had to vote on to more or less give itself its own pay cut, or else we'd be shut down by the state of Minnesota. And a common perspective is that med technology can achieve this goal. Basically, scientists working in a lab or an engineering school can come up with some intellectual property. University X's Office of Technology Commercialization wants to sponsor that. There'll be a licensing right. There'll be a cash flow that'll flow to a med school, and the school will prosper. So for those, I'm sure most of you know that universities are not all just a place for Mr. Chips movies to be made anymore. These research universities, there's a genuine revenue component as to what they're doing as well. And MedTech is a very vital part of that. So what can universities do? In a sense, this is all about a new course that got developed. And I like to find opportunities that are essentially Trojan horses, that once they're sort of instituted, lots of interesting questions come along, but because the execution is not that difficult, people are willing to engage in the question and take it over to the next level and say, okay, let's see if this will actually work. What I'm largely focusing on is the new technology ideas, the next novel thing that's going to come out here that's going to make a revenue stream. And as I'm going to conclude, I think that's very vital to health reform. As you can imagine, if you do any work as a health policy advisor, I've debated several of these folks before in different issues. And one of the things that came up frequently in this campaign is President Obama kept on talking about bending the cost curve down. Right? That wasn't talked about as recently. And so one question is, how can you really bend the cost curve down? A lot of our discussion today has been, what can we do about cost effectiveness analysis to bend the cost curve down? How do we use a nice score, perhaps, to say, peg it at this, you're not going to pay above this level, we're done. My hypothesis, getting to a punchline at the end, is the one way to bend the cost curve down is to innovate, to pick up on what Mark Pauly and other people have found before. Extend people's lives with full functionality. Mark and I are completely in agreement. Live to 90, have a wonderful day. You wake up one day in April, you've lived a full, happy life, and you're done. I mean, that pretty much kills the compression of morbidity hypothesis, and that to a certain extent, if innovation can achieve that, that's a good thing. The question is, how do we know it's going to achieve it? How do we have the people that are actually innovating, thinking about the whole gauntlet of activities of what they can do? So here's what universities can do to help those early stage inventors. Come up with some way to actually have a routine system that actually scales and looks at these innovations and sort of just weeds them out and say, no, 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 don't do that. There's no population for that. There's no revenue for that. FDA will kill you for that. IP will be too difficult. You won't be able to protect your patents. Basically make the future leaders engage with this, but also inside the universities that are actually creating these ideas, and not actually, now we've expanded it now to industry, say, maybe you haven't looked, but there's original art that's already in France. Stop. Figure out something else. And so the thought is, if the universities, actually our students, get involved in doing this for a fee, Mark talked about consulting projects that Wharton does, this takes it one step further, because I'll show you in a second, if you actually use this to also break down silos, it could actually be a whole different venture as well.